Let's expand the conversation. We're now joined by TB Accountability Consortium Project Director Russell Rensburg. Russell, a very good evening to you. Thank you for your time. We've just listened there to the Minister of Health, Dr. Aaron Motsoaledi, speaking about the ambitious target, looking to test around 5 million people as the world takes stock of the urgency of ending tuberculosis. What are your thoughts around the ambitious target?
Yeah. Ambition targets require ambitious budgets. But I think there's a big commitment, to end TB, we must find TB. Each year, around 270,000 people are estimated to acquire TB, and 66,000 of those never access a test or start treatment. And by not testing as widely as what we now planning to do, we actually increase the likelihood of TB death. And last year, or in 2023, 56,000 people died.
That's quite a significant number as we are looking to meet the World Health Organization's goal of ending TB by the year 2035. I mean, what does that speak to when we look at the challenges we still face?
Well, even by our own estimates, it doesn't look like we're going to meet that target. We're going to significantly reduce TB incidence. And what we mean is people getting affected by TB. But the reality is that, TB is a complex disease and it requires a multi-sectoral response. We know, for instance, that people on TB treatment also incur significant out-of-pocket costs, sometimes as much as 45% of their total income while undergoing treatment. So while we have all the tools, we have the right diagnostics, we have the right medicines, but the social aspects of people living with TB is an area where we need to grow.
Yeah.
So access to good nutrition.
So listening to also what the minister was saying, he spoke about the correlation with HIV and TB, and we know that with the immediate pause on most U.S. foreign assistance to South Africa, how does the hiccup, weigh heavily on whether or not we will meet that ambitious target set by the WHO in the fight against TB?
Look, I think firstly we have to be grateful to the American people who have invested in the HIV response in sub-Saharan Africa and the world since 2003. And I think without those investments, we wouldn't have got, or they wouldn't have accelerated countries like South Africa having the coverage that we do, where almost 78% of people who know their status, right, are currently on treatment and are virally suppressed. Linked to that, almost half of TB deaths have declined significantly since the highs of the 2010s, and by 2020, we'd actually met our midway targets for TB. So the relationship with TB and HIV is significant. So if we don't right now sort of consolidate our efforts and find ways and means to integrate the PEPFAR investments into our national health, TB and HIV program, we may lose some of these gains. But I'm fairly confident that there is a commitment, and in the coming weeks, hopefully weeks, not months, we will have announcements of how exactly the country will ensure that care is not impacted as a result of the withdrawal of the US funds.
You spoke a short while ago about the complexities of tuberculosis as a disease, and perhaps let's talk a little bit about the symptoms as you look at ways to amplify the urgency of ending the world's deadliest infectious disease.
It's a treatable, curable disease, right? So when we've made massive advances in finding TB cases. But I think one of the things that we need to do in universalizing testing is looking at ways and means that we can get people to take tests wherever they are, that they don't necessarily get to a clinic. If we could get tests done at your local pharmacy or a GP, we can make testing more available for key populations like men who are significantly undertreated, and in that way reduce transmission. And I think one of the ways of really doing this targeted universal TB testing is that the more people we test, the earlier we find it. And the earlier we find it, the quicker we can cure people and reduce deaths. So this campaign to increase testing by 5 million a year is a significant investment on the part of the state and will mitigate some of the impacts.
You single out men as you speak about some of the strides that need to be made. What are the challenges in that space?
I think obviously, there's stigma is a challenge, people's misperceptions around TB. A big part of TB stigma is related to the early days of HIV, when so many people died during the 90s and early 2000s before we had access to viable treatments. And I think some ways the best way you can deal with stigma is to universalize it, to normalize the idea of taking a TB test. And given a country like ours, which is a high burden country, and if you live in a high risk setting, I think it's strongly encouraged that everybody tests.
Yeah.
And once we test, then we can work on all the other innovations that we have in South Africa, which include the most recent treatment regimens, the best. We have some kind of support for patients, right? And it also strengthens our primary healthcare system, because that's how we start connecting for the first time.
Yeah.
So I see this is the first step as a broader strengthening of the primary healthcare system, which is one of the critical areas that we have to invest in to cover 80% of the population's health needs.
Absolutely. Thank you so much. Perhaps let's leave the conversation there. Thanks for weighing in on our chat.